Good morning, I'm Dr. Ponu Shankara Pillai. So today I'm going to talk about back pain and its causes. So in the previous video I spoke about the structure of the spine. So just to recap, these are the vertebrae or the backbones, the white structures here, and these transparent structures right here, they are the discs. So the discs are nothing but soft gelatinous structures that give a cushioning effect to the spine. So if there were no discs, you can see that these bones would, hit against each other. They would rub against each other, and which is not a good thing, right? And also the spine would not be flexible if we didn't have these discs. So these yellow structures here, these are the nerve roots which branch out from the spinal cord. So inside the vertebral column lies the spinal cord. It's not visible here, so it's inside the vertebral column, and from the spinal cord these nerve roots branch out. So the nerves up here, they supply they control the sensation and the movement of the hands, and the nerves down here, they control the movement and sensation of the legs, and also the bladder bowel control. Bladder bowel control means those nerves that control the urination and the defecation. So that's about the structure of spine. So low back pain is a very common health concern. So what are the causes of low back pain? It has a wide range of potential causes, and the most common causes include muscle sprain, muscle spasm, arthritis, disc issues, etc. So the usual history is a patient coming to me and telling me that they started having back pain after they lifted a heavy weight, or they went to the gym and lifted a heavy weight, or they did something that involved bending over for a long time. So this is the usual history. So what happens when you lift a weight? There are some muscles on either sides of the vertebral column. It's called the paraspinal muscles. So when you lift a weight even as low as 5 kg, it can hurt the paraspinal muscles, or it can cause a strain on the paraspinal muscles, and also it can cause a strain on the discs. So these discs can either tear, or sometimes the tear is big enough that the pulp-like material can come outside, and this causes pain. So the pain can be very severe in the initial few days, and that might need painkillers, and with time, within like a span of 2 to 3 months, the pain gets better with exercises and physiotherapy. So like I said before, these are the nerve rootlets which are coming in between the discs. So the lower nerve roots, they supply the legs. That means it controls the sensation and the movement of the legs. So sometimes what happens is the disc, when it comes out, it can hit one of these nerves. So when it hits one of these nerves, the patient can have intense pain and numbness radiating down the leg. It's called a radicular pain. So the patient may have pain and numbness in the legs, but the nerve pinches up here in the lower back. Now, sometimes these discs bulge can even hit on the nerves which are supplying the bowel and the bladder that controls the urination and the defecation. So, and the patients can even lose control of those urination or defecation, and this is a surgical emergency. If anybody has such symptoms, then they should immediately meet a neurosurgeon. Now, what are the other causes of low back pain? So like I said, the joint between the two vertebrae is called the facet joint. So arthropathy or arthritis involving the facet joint can cause low back ache. There's something called HLA-B27 positive back pain or arthritis, seronegative arthritis. All these can cause low back pain. So seronegative arthritis means the blood test will be negative for arthritis, but the patient has arthritis. So, and it usually affects the low back. Then there are other conditions such as tumors or cancers involving the spinal cord or the vertebral column. So most of these cancers, they are not primary cancers that arise from the vertebral column or the spinal cord. Most of these cancers are cancers that spread from other organs. The most common organs include breast and prostate. So prostate cancer and breast cancer can spread to the spinal cord. The vertebrae. So it can also manifest as intense pain, especially at night. Then tuberculosis, infection of the spine or the vertebrae can cause low backache. The most common type that we see is tuberculosis. So the patient may have other symptoms such as fever, weight loss, night sweats, all these symptoms. If somebody has these symptoms along with low backache, definitely we should go for an MRI of the lower spine. Now, if you see the spine structure, you can see that the vertebrae are arranged in a certain alignment. So these vertebrae are stacked one over the other like this. So sometimes with age or due to trauma, the alignment can be disrupted. That is called, and this is called listhesis. So when it happens in elderly or due to degeneration, it's called spondylolisthesis. So listhesis is nothing but displacement or loss of alignment of the vertebrae. So this can be easily found out in an X-ray, but other cases such as disc problems or the cancers involving the spinal cord or infections, all these will require MRI. There are some other conditions that can cause low backache, which are not related to the spine or the vertebrae. They could be like conditions that arise from the abdomen. The most common type is ureteric colic, whereby there is a kidney stone or a ureteric stone, which can cause radiating pain from the back to the groin. Sometimes pancreatic masses or pancreatic pathologies can cause low backache, uterine fibroids, or something called a pelvic inflammatory disease or inflammation of the pelvis and the genital organs can cause a low backache. So it's not just the spine or the vertebrae that causes low backache. The other factors also will have to be ruled out. Another common cause of low backache is bad posture. Like sitting like this is not really good for your spine. So sitting straight up like this is the healthy way of sitting. So it's called office syndrome. People who spend a lot of time in front of the computer or mobile, they can have low backache. So correcting bad posture, correcting your posture can actually give a lot of relief. So this is about the causes of low backache. Hope this was helpful.